I had worked in Vietnam for an NGO for 2 years, working in public health with the tribes, some tribes people there, the Bernard tribe, and was very frustrated because I didn't know as much as I wanted to know. So I know I needed to get more education. And then when I came back to the States, I traveled through Asia and Europe. And when I was in Nepal, I stopped at a little hospital there, a little Methodist hospital in Nepal, and I just loved it. I loved Nepal, I loved the people. So I talked to the nursing director and I said, what do I need to know to come back here to work? And she said, well, first of all, you need to be a midwife, because that's part of our nursing program here. All the nurses are midwives. And then you need to get a master's degree in public health, because you'll probably be the director of a maternal child program. So that was my goal. I came back to the United States with that in mind. And I picked Frontier Nursing Service because the literature said it was a 6-month course. So I wrote to them and I got accepted, and I moved to Kentucky, and I found out that the literature was old and that they required you to work there for 6 months before they admitted you to their program, and that you had to be a family nurse practitioner before you could enter their midwifery program. So they sent me out to a clinic in Wolf Creek, way out in, it was the armpit of FNS, it was way out. And I had a little book of directives, nursing directives, to take care of ear infections and colds and all kinds of primary care stuff, which I was not prepared to do. So I was kind of right back in the same situation I'd been in Vietnam. And so I did that for 6 months, and then I was admitted to the family nursing program, did my 4 months of family nurse practitioner, and then there was a second 4 months, which was just OB-GYN, where you learn to do prenatal care and simple GYN. And so after those 8 months, you were considered a family nurse practitioner. And then 4 more months to become a nurse midwife. So I ended up staying there roughly 2 years instead of the 6 months I thought about. When I finished there, I didn't have any money because I'd spent it all on my education. So I was looking for employment. I loved the mountains. I wanted to stay in Appalachia. So for a while I worked for the National Health Service Corps, going around to fill in for physicians who were on vacation or exploring new possible sites. And they finally found a place for me in Norma.